It's an honor for me to present this new technique, which I have done now for a few years, to help my elderly patients with a distal radius and forearm fractures. As we all know, until now, most patients about 70 years and older are just treated with a plaster of Paris during 4 to 5 weeks, because that's easy. It's on the first aid department. It will be treated by our junior residents, but nobody realized what is the real impact of giving a plaster of Paris to the elderly. Why shall we operate extra-articular fractures in the elderly? Well, if you go to the guidelines, which we use in Holland, about the treatment of distal radius and forearm fractures, you see we have about 8 Dutch Society of Surgery, Emergency Medicine, Physiotherapy. They all have their opinion what is the best treatment for the distal radius. But if we go to the literature, there was a nice study done by Justin Coe and Oscar Shen et al. About the operative treatment for geriatric patients that is not leading to an improved long-term patient-reported outcome compared to non-operative treatment. So let's think differently. If all fractures will consolidate, so let's evaluate what is the best treatment for the patient instead of treatment for just the fracture. If we go to the elderly patient, what is important for them? Living independent, staying on their own environment, ability to perform the activities of daily living. What is the impact of a plaster immobilization for a forearm during 4 weeks? You got stiffness of your wrist and finger joints. You lose about 1 kilogram of muscle. And of course, you got more problems in your activity of daily living. Here you see a 78-year female with a forearm fracture. If we treat this with a plaster of Paris, it will take at least 5, maybe 6 weeks of immobilization. But this patient was living on her own and she wants to go home and she wants to perform the activity of daily living as soon as possible. So we operate her in a daycare under local regional anesthesia. And she could go home, not the same day, but we leave because of her age 1 night in the hospital. And the next morning, she just left the hospital without the plaster of Paris, just with a double bandage. And she could home with only a very little help for the daily living. Here you see this patient again, the operation. The video on the left side shows the post-operative operation before she left the next morning. There was no pain and she had a good X-ray on the lateral and the AP view. You see on the right X-ray, that is one of the first patients. It was the first IlluminOss implant we had. The new ones were made with a spiral on the outside. Here you see the system. The IlluminOss system is a minimally invasive intraosseous fracture stabilization system, which is especially designed for osteoporotic bones, and it comprises of a reusable curing system, including a light box, light guide, a foot pedal, a special instrument system set, a disposable pack for every procedure, and implants for different shapes and size. So what we mentioned again, why shall we operate those patients? Mostly because social aspect. For example, as you see here, patients, we make a small incision about 1 centimeter, make a little entrance to the intramedullary canal, put in a guide wire, drill the intramedullary canal, and then put our peel-away system to introduce the IlluminOss balloon, as you see in the middle lower picture. And in the lower right picture, you see that we cure the infused monomer with blue light to polarize to an intermedullary rod. So the basic principle, as you see on the right slide, it goes in small, and by filling it with the monomer, it expands and gives a complete filling of the intramedullary canal, which results in an axial and longitudinal stability of the fracture. And in studies recently done by Van Ooyen at the Technical University in Delft, that the forces and the stability of this implant is completely comparable with the volar plating system, which is used mostly for some complicated fractures all over the world. So not only minimal invasive with 1 centimeter access through the skin, the same stabilization as a volar locking plate. This is one of my favorite patients. This lady was 94 years old. She had a bad vision, was almost deaf. So I phoned her family doctor, what shall we do with this lady? His advice was, please operate on her because she's living on her own and she's very persistent to stay on her own in her own home. So I treated her with 2 intramedullary devices from IlluminOss. The distal ulna was treated through an entry point of the olecranon, and the distal radius was treated through an entry point of the distal radius. Here you see the results. Operatively, an anatomic reduction of the fractures, and you see already pro and supination during operation. Because of her age, we kept her 2 days in the hospital, and I gave her, because it's a double fracture, only a soft cast for the distal forearm. And after 2 weeks, she came back to the outward patient clinic. She only had a little support in activity of daily living. And on the video on the right side, you see her function after 2 weeks. I asked her slowly move it, but because she didn't understand me well, she started really enthusiastic moving the distal radius, and she had no pain at all. The next patient I see is a lady of 96 years old. She had no social network and had a bilateral distal radius fracture. What to do? Of course, you can treat her with 4 weeks or 3 weeks or plaster of Paris, but that means that she needs an extra help at home at least. And there was no social network, so that will be quite expensive to organize that in Holland. So I operate her, I put in 2 IlluminOss implants, and on the right videos, you see during the operation or post-operatively, the same day, the function in pro and supination on both distal radius. Because of the double fractures and no social network, she stayed for 3 days in the hospital, went home only with a tubigrip double bandage, and she was self-supporting in most activity of daily living. On the right side, you see the result after 8 months post-operatively. There was a complete consolidation in an anatomic position. I treated 127 patients with a median age of 79 years, 99 distal radius fractures, 28 distal forearm fractures. The bone density was less than 2, and 106 patients, 80% of my patients returned to their activity of daily life within 1 week post-operative. If you go to the literature, the 6 randomized controlled trials published between 2011 and 2019 for distal radius fractures showed an average age of 69 years. My patients were 10 years older, and we had great results. Of course, every operation can have some complications. I had 4 patients, 3%, who experienced a minor complication. 2 patients had a superficial skin infection, with no infection of the implant. One patient had a postoperative pain syndrome, and one patient had an irritation of the extensor pollicis longus tendon because of the IlluminOss was producing about 4 millimeters, and I did a reoperation and cut the 4 millimeters who was protruding, and then the problem was solved. Thank you. I was happy to show you this new result. It's not only easier for the doctor, but it's much more better for the patients, and they are very grateful that they have only small operations, almost no complications, and they keep their ability to stay on their own without support at all. Thank you so much.